Hello, it's Bruce Williams again, and today I want to present part 9 of my series on the selected gross pathology of the reproductive tract. It's going to be very selected today because we're going to talk about diseases of the fetus and neonate. There'll be issues that happen in the perinatal period. We'll cover a variety of conditions, including normal disorders of birth, malformations, even some infectious disease. When I say it's going to be very selected, this isn't a tremendous range of diseases here. We're going to look at some classics, talk about some general concepts. This lecture is not meant to be encyclopedic. Entire books are written on this subject, which we're going to cover in the next half hour. As I do at the beginning of all of my lectures, I want to thank those friends and colleagues who have provided me images over the years, either directly or through online collections, which allow me to put these lectures together. Okay, let's begin with intrauterine death. In our last lecture, we talked about a large number of infectious conditions which can result in intrauterine death of a fetus. We're looking at the uterus of a macaque in which there was unfortunate intrauterine death. You can see the changes to the uterus. Now, a couple things would happen. If this was a production animal and the corpus luteum was lysed, was no longer intact, the cervix would be open and the dead baby will be pushed out, and the membranes will be passed as well, and that's what generally happens. In some cases, if you don't have that sequence of events, then an intact corpus luteum will result in a closed cervix. The baby and the fetus will be maintained. And then you can have a couple of possibilities, because a lot of times this happens in low-grade endometritis. You may have pre-existing bacterial infection, or bacteria may have gotten to the uterus through the bloodstream. And this endometritis will eventually result in maceration of the fetus. The fetus will break down. If it is in the last trimester, you will still see bones and hair, which are very resistant to the inflammatory process that will break the fetus down. But if you see this jumble of bones, this foul-smelling material, this is known as a macerated fetus. If there are no bacteria present, then you won't have maceration of the fetus. It will wither, it will dry, and it will become a fetal mummy. Now, fetal mummies, while they are interesting to look at, they generally are very non-productive, and you rarely get any diagnostic hits on a mummy. They're generally sterile. So this is a case where we want to look at the placenta, we want to look at the dam instead, because mummies aren't a whole lot of information. Now, to get a mummy, you have to have a couple of things going on. Here's a great mummy. You can see how dried out it's still connected to the placenta. A couple things that must be present to get a good mummy like this. One, the fetus must die after the bones are complete, or it'll just be resorbed. If there's no bones, then there's nothing here to really, essentially, to mummify. Okay, the fluids from the uterus and the fetus have to be resorbed relatively rapidly, so there has to be a good functioning blood exchange system within that uterus. There can't be any oxygen in the uterus. That often will feed any bacteria that are pregnant or that are present. Why do I keep confusing those two words today? That are present. And finally, almost no bacteria, if any. And the ones that are in there had better not be anaerobes, because they'll function in the absence of oxygen. You can have a mummy which is twin to a viable fetus. So sometimes only one will die, and another one will be born normally, and the mummy and the placenta will be passed. Sometimes they may result in dystocia as well. And now that we're talking about dystocia, dystocia can be a real problem. It arises from a number of reasons. It's obviously extremely damaging to the fetus, also may result in the death or ultimately the slaughter of the mother, who probably will not be useful for additional births in the future. Dystocias may be the result of abnormal positioning. There's a classic abnormal positioning of a rhesus macaque, and this you've probably heard of. It's known as the breech position. The normal position for the birth of any fetus is head first, generally legs out for quadrupeds. It's like they're diving out of the uterus through the vagina and out into the world. That is the proper way, and any deviation from that is fraught with problems and may result in dystocia. And the classic here is the breech presentation, which is an emergent situation in any species. Sometimes they are basically positioned correctly, but things do go wrong. Here's a foal. It is positioned almost correctly, but the head is turned under, and that's enough to result in difficulty in delivery. The birth process tends to differ between species. In horses, it is a very quick and somewhat violent process, as a baby is pushed hard and spasmodically out into the world very quickly, and any abnormality in position can not only result in the failure to expel the fetus, but also may result in significant trauma, as a bent hoof may catch the wall of the uterus and tear it. We looked at uterine tears in the previous lecture. Other things that could be abnormal, one leg could be bent backwards, and the head could be forward, and that could be enough to result in dystocia. So any abnormality in positioning is a significant problem associated with dystocia. Sometimes you get dystocia because babies are simply too big to pass through the birth canal. One of the problems when animals delay delivery, and people delay delivery, is that in the very late stages of development, in the last week or two, the baby is growing. If it's a healthy baby, it is growing and putting on a lot of weight, and that's something that happens proportionally throughout gestation. So the last week of last week of pregnancy, human babies can put on anywhere from a half to a pound of weight, and that's why due dates are very important in human births, to make sure that the baby comes out at an appropriate size, because anything larger, especially natural childbirth, is going to be a problem. And there's no reason to imagine that the same process does not occur in animal species. They just don't get all excited about their due dates. One of the interesting exceptions are guinea pigs. Pregnancy is really tough on guinea pigs. They have a lot of pregnancy-related diseases. They have a lot of dystocia because guinea pigs will have 1 to 2 rather large precocious babies. When they come out, their eyes are open and they start running around almost immediately. They have to, because the moms are such terrible moms. But the moms will gain up to 60% of their body weight. They have 2 rather huge pups that they will deliver, 1 or 2, and because they are so large, the incidence of dystocia is rather large. And guinea pigs pretty much have to be bred within the first 7 months, because after that, the bones of the pelvis have actually fused together. It's a bony fusion. Before 7 months, they will lyse during delivery under the control of a hormone called relaxin, and you'll have a relaxation of the bones and a lysis of the cartilaginous junction between the pelvic bones. And the whole thing will open up so these giant babies can come through. It's a great adaptation for this particular species and a lot of other species who give birth to rather large babies, like dogs in the case of English bulldogs, where dystocia is pretty common, probably wish they had this particular adaptation. So a very large baby may get caught in the birth control in an older primiparous guinea pig. And what happens is you often will see, these are two pups that were delivered by this guinea pig. And if I asked you which is the normal, which is the abnormal, hopefully you would identify the one on the left as the abnormal. This was a normal one, and generally you'll see marked swelling in animals in fetuses that have been delivered during a dystocia. There is often compression of the umbilical cord, and you will get, when you compress that, the uterine arteries will continue to pump blood in, but you get the compression, it obstructs the outflow of blood. And so if this goes on for a prolonged amount of time, along with the contractions, so you get a lot of swelling in fetuses delivered after a dystocia. Something else that can cause a very large fetus and difficulty in delivery, in this picture from Dr. Helen Ackland, is intrauterine death and bacterial gas production. Under the skin, in the gut, you get this emphysema, and it adds to the girth of the animal and makes it very difficult to pass. So we talked about that prolonged gestation resulting in giant fetuses. There are some diseases that will do that, including hypothyroidism. Hypothyroidism in sheep may result in prolonged gestation and increase the number of dystocias. So anything that's going to make the baby big or the pelvis small in the mother is going to predispose to dystocia. Okay. I said this before, I think we mentioned this in the last lecture, but when we talk about, at least in production animals, who tend to have one or maybe two, anything more than that is a bad thing. Horses don't get excited when they find out they're going to have twins, and the owners don't get excited when they're going to find out they're going to have twins. As I said before, twinning is not winning. Placentation, uterine size, is made to have a particular number of babies. It is less important in animals that particularly would have large litters. Rodents, certain rodents like mice, rats, dogs, cats who have large litters, and generally there is enough placentation to go around. When a horse is born, the placenta essentially covers most of the body and the one horn, sometimes two, of the uterus. It's diffuse placentation, and it needs that much to nourish this rather large infant and developing fetus. Okay, when two are crammed in there, the best they can do is half of normal placentation. And so one or both of these fetuses are going to end up malnourished. About 30% of abortions in horses are the result of simple twinning. And then you have a 65% incidence, give or take, of abortion or of stillbirth of one or both foals. And when the numbers for survival of twins are poor, with only 15 to 20% reaching the second week of life. So twinning, at least in horses, is not winning. Triplet kids, all sharing the same placenta. So 2 kids probably will do okay. Throw another one in the mix. Everybody, these two are doing, this one seems to be doing quite well. These two, this one's severely stunted and malnourished. So You can only split a placenta so many ways. Another condition that has been identified as causing abortions or stillborn in up to 40% in some studies is umbilical cord torsion. It's not seen in many species, but primarily in the horse. In the horse, the umbilical cord is very long and maybe up to 80 centimeters in length. The number of, you can see that there is tremendous congestion. If you can count the twists, 1, 2, 3, 4, 5, 6, 7, 8, everybody disagrees on the number of twists which are required to affect blood flow. Most textbooks will say, or experts in the field will say, it's 4 to 5 to affect blood flow, and anything over 7 may result in loss of the fetus. So you can just count them. It's probably 8 here, and we're looking at a fetus that has been lost. Here is a small ruminant, and it is covered with yellowish orange feces known as meconium, a combination of well, essentially it is fetal diarrhea. They don't eat much, obviously, in the uterus, but they do continually swallow amniotic fluid. There's a lot of, and in the amniotic fluid you have a lot of squamous epithelium, which has been sloughed by the fetus during development. You may have hair. If it is one of the precocious breeds that has hair, anything that's in the amniotic can end up as sort of a loose, non-foul smelling fecal material, which is known as meconium. And it's not uncommon that fetuses will, during the birth process, which is a time of great stress, to eliminate, and they will be born and with this material within the amniotic sac. Now, in times of severe fetal stress, maybe some hypoxia, maybe some dystocia, when the process takes a long time, they're exposed to this fecally contaminated amnion, and they're breathing it in. They will swallow it. You will find meconium within the lungs, not uncommonly in normal animals, but you'll find a very large amount in animals that are born under distress. And this is what you might see in a distressed animal who took too long to be born, dystocia, so difficult birth. The animal is still within the amniotic sac, re-swallowing and inhaling this fluid. A little bit is not going to kill any animals. When the lungs have this orange appearance to the anterior lung lobes, then this may result in postnatal hypoxia. So this is known as Meconium aspiration. Okay, let's look at some of the malformations that are not common. They're never common, but you'll see them in the textbook. Some of them that you want to know the names of because they are very characteristic. One of the things that I always want to stress is when you have a congenital abnormality in any animal species, if the animal looks fairly normal, but you note that it has a cleft palate or it has one abnormality, ectopia cordis, anything, even a minor abnormality, look for more. Birth defects are like constellations. There's usually multiple ones. If one thing is wrong, there often is another, and the numbers go up in non-viable fetuses. Okay, one of the classic fetal monsters, so to speak, can be seen in cattle. This is called the amorphous globosus. Okay, this is usually born as a twin to a perfectly healthy calf. And you'll see parts of a calf in here, but they're usually without order, and you have a very limited tissue selection. They may have they're obviously covered with haired skin. There'll be skeletal muscle. You may have some very primitive malformed heart or lung tissue, a bone or two, maybe even a tooth. It's an acardiac fetal monster, obviously is never going to be viable. And it's usually seen in cattle. You can also see them in sheep and goats and horses. Note the umbilical cord. It does get its blood supply from the placenta. And I always thought that if properly cleaned and preserved, these would make excellent throw pillows for the living room of the diagnostic pathologist. A constellation of birth defects is seen in ruminant and horse monsters known as Schistosoma reflexus. These usually have some very characteristic features. Okay, just looking at this particular animal, you can pretty much guess that there's going to be a dystocia. There's no way for it to be presented properly. But it doesn't matter because there are so many defects here. You have a spinal inversion, so the back limbs actually are flipped back over, often over the back of the animal. You can see that these have been inverted here. There's usually a ventral fissure of the abdominal cavity, resulting in eventration of the abdominal contents. The limbs are generally ankylosed and fused. There's hypoplasia of multiple organs, especially the lungs, and because of the lack of an intact diaphragm. So there's a lot of stuff going on, but it's a very classic presentation. Schistosoma reflexus. Some fetal monsters may be viable for a very short period of time, may be stillborn, but because of the constellation of defects that you will see, they don't last for very long. This animal was obviously not an abortus. This is a variant of a Dexter cow, which has multiple defects. This is known as a Dexter Bulldog. There are a couple of ones that are fairly close. Snorters, snorters are a form of bulldog calf, telemarks, but the Dexter Bulldog is a byproduct of breeding for particular characteristics. Dexter calves are very small, and people that have a little bit of land or they want to have a little farmette, they need small cattle. And so the Dexter breed has become very popular. It's about half the size of many of the other breeds of cattle. They have short legs, which is never a good thing. So when we look at these particular animals, they have short, inwardly rotated limbs. They have significant craniofacial abnormalities with a domed head, a brachycephalic appearance. There is such brachycephaly of both the maxilla and the mandible that the mouth is too short to contain the tongue. And then obviously respiratory problems are going to be a significant problem here. They often will have areas of defective endochondral ossifications of many of the growth plates. So there's little growth in the length of the long bones. They may have abdominal hernias. So the bottom line is, when you see these type of monsters, you want to think about the possibility of many different defects contributing to the phenotype of these animals. Here's a great picture from Dr. Panagiotis Loukopoulos from Australia, and documenting the presence of a fetal monster in a dog. They can happen in any species. Once again, multiple abnormalities. This animal had extra hind legs, or polymelia, had no legs in the front, had ectopia cordis. If you look in here, you can see the heart, hydrocephalus. The liver itself was very large. It seemed to have a duplication. So this is what you do with these fetal monsters. You just go very carefully in a very thorough manner to document all of the different abnormalities. If you just say, well, this one has no legs in front and too many legs in the back, you're going to miss a lot of the various abnormalities that you'll see in these animals. Even in animals that I posted with something very common like a cleft palate, if you look closely, you will often find that they're missing a kidney, or they have small loops of bowel or something, because birth defects come in batches. Here's a fun one. People call this a Janus animal, also known as Diprosopus. This animal has two faces, and this animal actually lived for a number of years. It is not always incompatible with life. You have the two faces. You have a eye, at least the opening for an eye here. Sometimes Janus animals will have two completely developed faces. Another great cause for dystocia. It'll be tough to get that through the birth canal. This one's tough to even count how many legs here. There's one head, there's two bodies, looks like there's 8 legs. So fetal monsters will come in all types of different varieties, and with the exception of a couple of the classic ones like the Amorphous or the globosus or the Schistosomiasis, you never know what you're going to get. So there are classic syndromes affecting one system, which may be seen in largely viable animals that are well documented. And we can look at a couple of them. There's no way we have time to look at all of them. This is one that may be seen in a number of different breeds of cattle, which affects the cardiovascular system, particularly the development of the lymphatic system. It's seen not only in cattle, you can also see it in pigs and dogs and people. And it's known as congenital lymphedema. All of these are the phenotypic appearance of a genetic defect, point mutation, something like that. You can always trace these back now to a genetic abnormality. This one is a defect in the production of alpha podoplanin, and this is a glycoprotein that is expressed by lymphatic epithelium, especially during development. And so you get a variation, a gradation of lack of development of lymphatics and lymphatic drainage. The mild cases, you may only see mild stocking, swelling of the legs as the lymphatic drainage is poorly seen down there. And that's the most common one in people. You can get all the way up to a total lack of formation of lymphatics and lymph nodes in some animals, which have severe anasarca, or swelling throughout the body, throughout the abdominal viscera. And this one is sort of a case in between, where the animal had significant swellings across its body. So here's a fun one, you see. And this is not a defect of the heart. Although the heart is on the outside of the body, you can see this up in the neck or anywhere down through the thorax. It is actually an orthopedic defect. And orthopedic defects are are fun because they're easily picked up. This one, you have a lack of fusion of the rib cage in the area of the sternum, an overlying defect of the skin, so the heart is actually exposed to the environment. People live with this for a long time. It can be surgically repaired in people. Obviously, no one's going to go to the trouble to do this in a calf. An ectopia cordis. Another orthopedic defect, one of the most common that is seen in animal species. This is in a sheep. This is cleft palate or palidoschisis, often is accompanied by cleft lip. And you can actually look in, and what you're looking at is the bottom of the sinuses. And these animals obviously are going to have problems eating. It's a defect in the lateral ingrowth of the lateral palatine shells, which should fuse in this area, and for some reason they do not. Very common in all animal species. Here's one in a young macaque. Number one in most animal species. Llamas and other camelids, they have it all the time. And one of the things about camelids, especially the cria of llamas and alpacas, is just the tremendous number of birth defects. If the animal's born with everything working properly, they do very well. I once sat in on a very interesting 2-hour lecture on diseases of camelids, and about the first hour and 20 minutes were all the many birth defects that they get, and very little after that. So palidoschisis is a very common problem in many animal species, including humans. Other abnormalities of the musculoskeletal system, one of the things that you will see from a wide range of causes is a condition known as arthrogryposis. Okay, this is an abnormal twisting or fusion of the legs. It is most commonly seen as a result of defective growth of the muscles due to viral infection in utero, especially certain types of viruses like Bonia viruses, which tend to affect the developing spinal cord and brain. And of course, we know that muscles have to have innervation to function. If you cut off the innervation to a muscle, it will atrophy. Well, if the innervation was not there, if the nerves or the spinal cord were damaged, especially by a virus during gestation, then those muscles will not form. What you do is you get these sort of taut bands of fibrous connective tissue. You get abnormal positioning of the limbs, and arthrogryposis. This is a condition that's only seen in developing fetuses. Obviously, it may be, the most common cause is viral. You want to think about the possibility of congenital cases. You can see that in a number of breeds of cattle. Another cause would be a plant toxin. There are a couple, including lupines, which causes a flexion contracture of the forelimbs due to the presence of anagyrine within lupins. You would also consider the possibility of ponderosa pine, which is a very interesting one. Another reason that you'll get this arthrogryposis is if the animal is unable to extend and move its legs. We all know that babies are very mobile in the amniotic sac and uterus, and they're going to move. But ponderosa pine is an interesting plant. Yeah, ponderosa pine has a toxin within it that is causes prolonged uterine contraction. So the urine contracts, and that contraction is maintained, and the fetus cannot extend its legs and move them around, and they end up with arthrogryposis due to the inability to extend in the development of the muscles in a very contracted position. Another not uncommon defect are defects of the orthopedic system, which affect the dorsal vertebra. This is a very mild case in a lamb, and when it's down in the lower lumbar area, this is also often referred to as spina bifida. This is a very mild defect, largely of the skin, but they can go all the way down to the spinal cord, where you have a loss of the overlying dorsal vertebral arch. And in severe cases, as seen in this litter of ferrets, you can see that there are, and this is all the same litter. This was a defect that was noted in color-diluted animals because of the close correlation of migration of the pigmented cells of the neural crest to many areas. These animals were white. They had a number of defects, including severe cranial tube abnormalities. Here you can see that the skull is open, most of the cranium is lost. All of these animals, well, you can't see from this particular angle, had large defects from the skull down to the lumbar area, in which the dorsal vertebral arch had not formed properly. The overlying skin was open, and the spinal cord of the animals were delivered largely without large segments of the spinal cord. Some of them had fusion of the cranial vertebra, resulting in this stargazing position. This particular one is the one I referred to earlier that had cleft lip, missing several ribs, as well as one of its kidneys. So constellations of birth defects, but neural tube defects have been associated with a number of things, not only the defective migration of cells from the neural tube to ultimately the area where they will develop properly, but also this has been identified in some, at least in non-human primates and primates, a higher incidence in animals with folic acid, or people with folic acid deficiencies. So when a pregnant woman, as part of her neonatal medical workup, will always be prescribed vitamins that are high in folic acid to prevent neural tube defects. Multiple congenital defects as a result of viral infection. We have the arthrogryposis we talked about. Look, the back legs are fused to the side, the front are fused in a contracted position. There is kyphosis and scoliosis to the spine. We have marked brachionathia of the mandible, and probably there are other orthopedic abnormalities this animal was virally infected. This is something that has popped up within the last decade. Schmallenberg virus, a variant of bunyaviruses, or a number of bunyaviruses, will cause this marked orthopedic malformation in developing ruminants, both small ruminants and cattle. So Schmallenberg, first identified in Schmallenberg, Germany, and the other bunyaviruses, usually named after the place they were first identified. Akabane, Aino, both from Japan, Cache Valley from the U.S., will cause this constellation of orthopedic abnormalities, among others. Another plant toxin that causes significant orthopedic abnormalities depending on when it is ingested comes from the plant false hellebore, and results in a condition that was named for many years cyclopia, or cyclops. When ingested at day 14, it causes profound abnormalities of the developing skull and brain. It causes it interferes with the bisection of these structures. So you have holoprosencephaly, in which instead of two cerebral hemispheres, there is one, which also means there is a lack of division of the developing eyes, so they're actually fused. You have two eyes in these animals. They actually suffer from a condition known as synophthalmos rather than cyclopia. This is the eye here in this young lamb, the mouth, the nose, if there is any. There's very poor development of the front of the brain. So if there is a nose, it is generally very rudimentary and often located in the area of the forehead. There's a very classic appearance to this particular lesion. Here's a great one in a calf which survived for a short amount of time, and you can see that fused eyes. And generally you have to ingest this particular plant during somewhere between day 12 and day 14 to get this particular defect. It also will exert effects further down the road. If ingested at day 28, you will get a shortening of the legs. No facial abnormalities, but a shortening of the legs. So, the plant name is false hellebore or Veratrum californicum. A lot of people refer to it by its Latin name. The agent is cyclopamine. This is also a rare congenital abnormality in non-plant eating species like primates or pigs or dogs or whatever, generally due to some defect in the homeobox gene, which is important for the cleavage of developing structures and the formation of two eyes, two legs on either side, two halves of the brain, etc. Very important for the bilateral symmetry of the developing fetus. Just a couple of other fun abnormalities that will manifest in the neonatal period in the musculoskeletal system. We're looking at the rib plates from two different cats. The left is normal, the right is abnormal, and you can see that there are multiple fractures, probably received during the process of delivery. They have no connection to the costochondral junction, so this shouldn't be interpreted as anything like vitamin C or vitamin D deficiency. They're all much higher on the ribs. This animal has multiple bones that have been broken because it suffers from a condition named osteogenesis imperfecta. Osteogenesis imperfecta, seen in a wide range of species, not just cat. You can also see it in ruminants, certain breeds of cattle, such as Holsteins and Charolais. And this is the only condition that results in not only a reduced quantity, but also a reduced quality of bone, because the animals have defective production of type 1 collagen and osteonectin by osteoblasts. And so severe cases result in defective collagen that can't be cross-linked. And because type 1 collagen is incorporated into bones, these animals have extremely fragile bone. And so another case in a cat which shows, and you would see multiple fractures and poorly formed fracture calluses in affected animals. Osteogenesis imperfecta manifests by poor bone and teeth quality in the immediate postpartum, usually evident in the immediate postpartum period. And just one more really fun lesion of it's a obviously not a fatal abnormality. 1, 2, 3, 4, 5, 6 toes. This is polydactyly. You can get too many toes. You get too few toes, where some of the toes are fused, and you have cattle with one hoof like a horse, or pigs with one hoof like a horse. So polydactyly is a condition that actually some people in the breed cats have exploited. So you can get 6 or 7 toed cats. They're called American polydactyls, and you will pay a lot of money for them. Also, Ernest Hemingway's house in Key West is filled with these polydactyl cats, which he didn't raise purposely, but they sort of took over his house while he was living there, and they're called Hemingway cats. So you can go to Hemingway's house in Key West and see these polydactyl cats. Diseases that you may see in the skin in the neonatal period, they're of interest, certainly worth knowing about. One would be Ichthyosis fetalis or Ichthyosis congenita, and both of these are genetic problems which have to do with the genes that promote the liberation of lipids from stratified squamous epithelium, and they are defective in lipid production. And what happens is that they form these rather large plates. Ichthyosis congenita may just be some rather thickened skin over the areas of flexion, but this Ichthyosis fetalis, you can see, are these very large plates of skin that simply won't slough because they don't produce the lipids which allow them to come off in by one or two cell layers, and they form these sort of rhinoceros hard plates. It is a life-threatening condition. Here's a lesion that you could see in aborted fetuses, which we talked about. Usually these are calves or small ruminants that the mother has harbored a mycotic infection. And one of the things that you will see are these sort of epidermal plaques. And if you scrape them or did an impression, you would see fungal hyphae in them. Another great place to do is to culture the gastric contents, because in these animals with mycotic infections, the fungus makes its way into the amniotic fluid. The animal is continually swallowing it, and you can culture the stomach contents for the presence of the fungus. Externally, you will usually see these large hyperkeratotic plaques, almost look like ringworm infection in these aborted fetuses, mostly on the head and the neck, the shoulders, and the back. The fungus does not come in through a patent cervix like it does in a horse. In cattle, it usually comes in through a blood-borne infection and sets up root. The molds, Aspergillus is probably the most common, and these molds are omnipresent in the environment in moldy hay, so they can be inhaled, they can be ingested in moldy feed, and it is a hematogenous condition that will result ultimately in placental insufficiency, aborted fetuses, and a covering of the dorsal surfaces with plaques containing the fungal hyphae. As we look at a couple more infectious agents, and we can't cover all the ones that will infect the developing fetuses in utero, but we can look at a couple of them that will result in delivery of stillborn or weak fetuses. Pigs have more than their share of this. Here is a pig that is covered with pox lesions. Pox virus can cross the placenta, so you can have congenital infections. It can result in dermatitis and abortion of the neonatal pigs. So that's pox, one of the classic diseases over the years that has been caused, the classic disease of abortion in pigs was parvovirus. This parvovirus is specific to pigs and causes a wide range of changes. The syndrome itself was still is known as SMEDI. SMEDI, S-M-E-D-I, which stands for stillbirth, mummification, embryonic death, and infertility. And you can see just about all of that in this particular image. These animals, some of them look like they might have been viable or could have been delivered. Obviously, these were all removed at necropsy, but look at the marked growth retardation that is seen here. And depending on when the parvovirus would infect the animals, they might exhibit infertility. It's a range of abnormalities. But there are a lot of other diseases. Now, porcine circovirus type 2 will also cause similar type of appearances. Another litter of pretty good-looking piglets, except for this one is looking a little bit weak, and this one obviously has been mummified. So that would be Smetty. But you want to think about other conditions, including porcine circovirus type 2, which is a very common virus in swine. And you can even detect the virus in the heart of aborted or mummified fetuses. There are a number of other infectious agents, as we just look at pigs for a moment, that may result in abortions and stillbirths and weak animals. Leptospirosis, Harjo or Pomona or Bratislava may do that in pigs. Pseudorabies may result in the delivery of stillborn or aborted pigs, even Brucella suis. So there's a lot of them, and we can't look at every particular type of animal species because it's a very long list. One other one that will do this is porcine respiratory or PRRS. Porcine reproductive and respiratory syndrome is an arterivirus, which also often will result in the same range of stillborns, mummies, weak pigs, and premature farrowings. And one of the lesions that's been associated with that is hemorrhage in and around the umbilical cord. So there's a wide range, and the same wide range goes for many different species of animals that you can get infectious diseases resulting in significant neonatal mortality. And horses, one of the very common ones that will be seen in certain parts of the country that we do get very upset about is, and we have a current outbreak that's been going on for many years in Maryland, is equine herpes virus type 1, which will cause abortion or the delivery of very weak foals with a combination of little dots of necrosis within the liver, spleen, and lungs. It is often associated with significant interstitial pneumonia, with pleural fluid, and then histologically there is large areas of necrosis within both the alveolar lining epithelium and within the airways in these particular animals. A infectious disease of great concern to the horse community, which manifests and kills a lot of foals. Another infectious agent we've looked at a couple times, but I bring it back because the picture is so great, is a lesion associated with Campylobacter fetus or Campylobacter jejuni in small ruminants. A lot of times these animals are delivered somewhat autolytic, so you don't get the great lesions, but this is such a fantastic picture of the targetoid areas of necrosis associated with neonatal Campylobacter. I shouldn't say neonatal. The disease is transmitted to the dam. It is a septicemia. It gets into, and you have very few lesions, not a lot of clinical signs in the dam, but they will deliver these somewhat autolyzed fetuses with these very characteristic areas of necrosis in the liver. A newborn kid with a multifocal necrotizing suppurative hepatitis shortly before the kid was aborted. The mother showed clinical signs of fever. Maybe she had been fed poorly cured silage. That's usually more the province of sheep and cattle. Goats, you tend not to ever identify a source for listeria, but they certainly will get in there, and the listeria causes a septicemia within the mother, crosses the placenta, causes a very similar septicemia in the fetus, necrosis in the placentomes, placental insufficiency, and then they will deliver these stillborn fetuses with evidence of septicemia. A great lesion associated with listeria, a form of sporadic abortions in ruminants, and a rewarding disease in that you can take a simple gram stain and you put it on these areas of necrosis in the liver, or the areas of necrosis in the placenta, or wherever you find necrosis, and it will almost always show you a really nice population of gram-positive rods. And then one more infectious agent, which affects a number of species. I'm showing you the brain of a cat with a normal cat brain on the bottom, and then the brain of a cat on top. And you can see the cerebellum is markedly hypoplastic because this animal was infected in utero by a virus, which honed in on the developing part of the cerebellum, which is the external granular cell layer. It's the part that lives right underneath the meninges. If you necropsy a very young animal, you'll still see remnants of that as a line of nuclei underneath the meninges. And that's actually where all of the cells develop. The cells of the granular layer, the nuclei of the granular layer, the Purkinje cells all come from that. And if you hit that at the right time with a viral infection, you will get marked cerebellar hypoplasia because you wipe out the germinal cells. In the cerebrum, the germinal cells generally surround the ventricles. They're very susceptible at certain times to that. They're very susceptible to bunyaviruses, which will affect that periventricular granular or germinal cell layer and result in either massive loss of or hypoplasia, lack of development of the brain, which we call hydranencephaly. Sometimes it's very regional, which we call porencephaly. When we look at cerebellar hypoplasia in small animal species, dogs and cats and mice or rats, you want to think about parvoviruses. Parvoviruses will do this. And it doesn't always have to be in utero. You can get mild hypoplasia. You know that cats tend to, especially, and dogs to a certain extent, you still have cerebellar development after the animal's born. Cat cerebellums pretty much stop developing about 2 weeks after they're born. So even late infection can cause some very mild defects. But usually we see it's not life-threatening, but you see these cats that stumble around and really have horrible intention tremors, and they can survive, but it's not something that they don't need a lot of help with. So parvoviruses in small animals. In large animals, you want to think about pestiviruses. Pestivirus, bovine pestivirus or BVD is the one that will cause it in cattle. Ovine pestivirus, or also the conditions known as hairy shakers, will cause it in sheep. Hog cholera will cause it, or classical swine fever is a pestivirus that will cause cerebellar lesions in pigs. So large animals, pestiviruses; small animals, parvoviruses, and you will keep it straight. Last thing I want to talk about, I got a couple more things. So, and I don't have a good place to put this, so I'm going to put this in this particular lecture, diseases of the perinatal period, and we are looking at the umbilical cord, the umbilical vein, right here, running over the surface, and the paired umbilical artery. Normally, when the animal is born, you will have almost immediate thrombosis of the umbilical arteries. The umbilical vein will stay open a little longer to help to circulate blood. You don't want that to clot, and then the arteries keep pumping blood. So these thrombose almost immediately, and then the vein will stay open just a little bit longer, allowing for a sort of autotransfusion of the remaining blood from the placenta to the fetus. Within a week of birth, the umbilical veins are usually totally thrombosed, and they are replaced by fibrous cords, which we call the round ligament of the bladder. And then you have a urachus here, which drains the bladder. So normally what we have is we have the urachus, and then we have the two umbilical arteries. Now, rarely will you ever see a problem with the umbilical arteries. This one usually happens quite a bit. But what happens is the umbilical vein, one umbilical vein, two umbilical arteries. The umbilical vein tends to stay open a little bit longer, and sometimes it doesn't close properly. And it's a great way because the umbilical cord is going to be sort of moist and open and weepy, and the animal is in a stall where it might be exposed to poop. There's always a lot of poop around, and so if it lays down the poop, you could get an infection of that open umbilical vein, and this is known as navel ill. The umbilical itself will be sort of full of pus and a little bit painful and maybe draining. It may be draining 7 days later, 14 days later. That should be all dried up by then. If it still is, you may have an infection of the umbilical vein. The umbilical vein, remember, goes straight up to the liver, becoming part of the ductus venosus in the fetus. And so it is a great way to run an infection up into the bloodstream where it gets into the liver. It's called navel ill if the umbilicus is infected. If the umbilical vein becomes infected and the animal develops septicemia, which is often the result of coliform infections, E. coli, salmonella, all sorts of things that are in there, then the condition, because the joints are so commonly affected, is known as joint ill. So most omphaloflebitises result from a patent umbilical vein, which provides a nice portal for bacteria to get into the systemic circulation of neonates and cause all sorts of problems further on down the line, like bone infections and abscesses throughout the body. Here's a very dehydrated looking baby. And another problem that you can see in certain species, especially mammals, especially non-human primates, are just poor mothering skills. Guinea pigs and rabbits, rodents and lagomorphs, they're generally very poor mothers to start with, but they will have precocious babies. They will sometimes, with guinea pigs, as we said, the babies are born with their eyes open, they're fully haired, they're running around within 5 minutes because the mothers are generally so poor they come by once a day, whether the baby's needed or not. If the babies can run them down, they might be able to get some milk. And but there are a lot of species in which the development of the baby, like in non-human primates, is very prolonged. And if we're dealing with a first-time mother who might be nervous, or you might have some issues, social issues in the troop or whatever, they may not know how to properly take care of the infants, and the infants might not get fed, and this animal just got dehydrated and unfortunately was the result of being born to a very immature and uninformed mother. So caring for children. And then another thing that happens can be trauma, either birth trauma, we've looked at that, or trauma in the neonatal period. Once again, we are looking at a young non-human primate with a large subdural hematoma. This can happen in a number of ways. Infanticide is known in a number of species. It's not that common in non-human primates. It is fairly common in certain large cats. It's seen in cetaceans, so infanticide is always a possibility. What happened in this particular case was that the mother was on a high area, and because they often carry the baby slung low around its waist, it jumped down and the baby hit its head on the concrete, resulting in the subdural hematoma. Perinatal trauma can be a problem as well. Okay, let's end this lecture. We have to talk about birds, because these are fetuses too. These are diseases of the developing fetus. So I want to just throw in a couple of egg diseases. You can get a little more information on these in the series that I just completed on diseases of avian species, but just a quick review. One of the things that you will see, egg quality problems are wrinkled eggs, shell-less eggs, and there are a number of possibilities. Remember that with the production of each egg, the hen has to mobilize up to 20% of the calcium in her body, pulling it out of her bones and putting it into that developing eggshell in the shell gland, where it stays for about 24 hours. It's the longest part that it stays in any part of the oviduct, and stays there and over the external membranes, which are put on in the immediately adjacent portion, the magnum. It puts on a covering of mineral forming the shell, and anything that interferes with the activity of that part of the body, like infectious disease, salpingitis due to coliforms, or salmonella, or a lack of mineral. If she's not getting a high ration of calcium, then she won't have enough to put the egg shell on properly. So wrinkled eggs, defective shells, something like that, may be a result of a lack of vitamin D. The condition is called layer paralysis. They often will not have enough calcium to properly move. So that's a cause of morbidity and mortality in itself. But the eggs are going to be abnormal in animals that are not getting enough calcium or vitamin D. A number of infectious agents will affect the oviduct and cause the abnormalities in the developing eggs. That could be coronavirus. Infectious bronchitis has been known to do that. There is a type of adenoviral infection from the genus Adenovirus, duck adenovirus A, which results in a condition known as egg drop syndrome. Not because of the shellness, but actually because there's a significant decrease in egg production. But there are abnormalities associated with this virus in poultry and ducks as well, and you will get abnormal eggs, and that's not something that you're going to be able to sell. So I just like this picture of poke. This is a truly shellless egg from a facility that the diet was deficient in calcium and vitamin D3. You can get bacterial infections on eggs as well. Not bacterial, but fungal infections. This is a case of aspergillosis. And remember that, a really good production facility is going to have immaculate brooder facilities, but some are not quite that good, and mold will build up, and there are always little minor cracks or something in the shell of the egg, and if those are colonized by fungus or bacteria, then you will have damage to the membranes inside the shell, and obviously this egg is not good for either making another little chicken, and certainly this is not something that you would want to see at the breakfast table. Just for fun, this is a bit of yolk sac. We talked about this a couple times in recent lectures. It was also mentioned in lecture number 8, disease of the gravid uterus, and this is the yolk sac, best developed in the avian species because that is contained within the egg. Is part of it is the yolk that we eat. It is the nourishment for the developing chick or the developing fetus, and after it is done, it is supposed to involute, and you don't get anything. They don't always involute, and because it's connected to the gut, you may have these little remnants. They might be mineralized. This one is inspissated. They're all sorts and sizes, and they should go ahead and be gone by the time that the animal pips and gets out of the egg. And a lot of times all you have left is this little bit of fibrous connective tissue which may communicate. It may actually have a lumen and communicate with the intestine. That's known as Meckel's diverticulum. So you see Meckel's diverticulum in mammals. Mammals have yolk sacs too. You might find a yolk sac remnant, which we talked about. You can find anywhere from the umbilical cord up to the GI tract, and mammals will get Meckel's diverticulum too. Chickens have omphalitis, just like they have mammals will have omphalitis. It's generally a much more rapid progress, identified much more quickly. It's characterized by that yolk sac we just looked at getting infected. And there are navels in young fowl. See, this is where it would attach into the gut. And you will see these unhealing navels which fail to close. And then you will have internal bacterial infection. This is a normal animal, and this is an animal with a infected hemorrhagic yolk sac. When you peel the skin back, you'll often see this hemorrhage, and you're looking for common bacteria that you would see within the brooders, Salmonella, Staph aureus, some coliforms like E. coli, Pseudomonas, and Enterococcus are all common causes of infected yolk sac and neonatal mortality in chicks. And with that, I think we're going to close this lecture. I apologize for it not being encyclopedic, but that one could go on and on and on. There are a number of great resources that you can look at. Entire atlas is devoted to fetal monsters, if that's what you're into. There's a very large chapter in both McGavin and Jubb and Kennedy dedicated to all of the different infectious agents, manifestations of those which cause abortion, stillbirth, and neonatal mortality. I hope I gave you a couple of new things that you didn't know, a couple of new fun facts, and I certainly encourage you to go and explore these other resources in greater detail. I also encourage you to come back to the Foundation's YouTube and Facebook channel on a regular basis, where we'll have additional lectures on various subjects in the gross pathology of veterinary medicine. Thanks so much for your time, and I really appreciate that. Our last lecture in this series will be on diseases of the mammary gland. I hope everybody has a wonderful day.